To effectively combat any illness, it's crucial to understand its root cause. High blood pressure, also known as hypertension or the silent killer, is no exception. Let's dive into what leads to high blood pressure and the symptoms associated with it, and therefore the simple steps that can be taken to improve it. To lead a healthier, happier, medication-free life. Some of the early warning signs of high blood pressure in women include fatigue, headaches, blurred vision, shortness of breath, chest discomfort, hot flushes, sleep disturbances, intermittent fluid retention in ankles, hands and eyes. These symptoms can easily be mistaken for everyday stress and anxiety or menopause-related issues. Therefore, regular blood pressure checks are crucial to detect and manage high blood pressure early, as it often goes undiagnosed. An imbalance in sodium levels can be a reason for high blood pressure, and this often goes unnoticed when consumed in higher quantities than the body needs, known as hidden salts. Sodium naturally occurs in unprocessed foods like milk and meat, but is also added to processed foods as salt to enhance flavor and act as a preservative. It is this added salt that can cause an imbalance in the body, leading to water retention and increased pressure in the arteries. If left untreated over time, it can cause the artery walls to stiffen and become hard. This is what results in high blood pressure. Approximately 70% of salt consumed comes from processed foods and eating out. The daily recommended intake of salt is less than 6 grams for adults. When choosing packaged foods, it's best to check the ingredient list. More ingredients often mean more additives. Opt for foods with fewer ingredients. Checking the salt content in the nutritional information is also a good idea, especially if you already have high blood pressure and want to keep it under control naturally. Women are at a higher risk of developing high blood pressure due to various changes in their bodies. During pregnancy, many women get their blood pressure checked for the first time at a prenatal appointment. This can reveal previously unnoticed high blood pressure. Postmenopause is another period when women face an increased risk of high blood pressure. Menopause is defined as the absence of a period for 12 consecutive months. During this phase, age-related changes in hormone levels and weight can contribute to the development of high blood pressure. It's important to note that the symptoms of menopause, such as headaches, fatigue, and hot flushes, can sometimes overlap with those of hypertension, potentially leading to undiagnosed cases. To naturally control blood pressure, adopting healthy lifestyle habits is essential. 1. Limit and reduce salt intake by eating less packaged foods and eating out less frequently. Opting for freshly cooked meals at home where you can control your salt intake. 2. Exercise regularly, aiming for 150 minutes of physical activity a week to strengthen your body and promote healthy blood flow. 3. Maintain a varied, healthy diet that includes potassium-rich foods like leafy greens. Potassium helps counteract the effects of already high sodium levels in the blood, relaxing artery walls. Berries like blueberries, strawberries, and blackberries contain anthocyanin, which can also widen the artery walls and make them flexible, reducing blood pressure and improving heart health. Calcium-rich foods like yogurt help lower blood pressure by relaxing and tightening blood vessels as needed. 4. Manage weight through a balanced diet and exercise. Practice portion control and mindful eating to avoid overeating. Continuous overeating puts extra pressure on the digestive system and leads to weight gain as well as other stomach issues such as bloating and gas. 5. Incorporate daily deep breathing exercises. This enables fresh oxygen to enter the body and causes the mind and body to relax. Practice positive affirmations to maintain a positive mindset. 6. Regularly monitor your blood pressure to keep it under control, as high blood pressure can lead to serious illnesses such as heart disease and stroke. Blood pressure is described by 2 numbers, systolic, which is the top number, and diastolic, which is the bottom number. A healthy blood pressure reading should be around 120/80. If your blood pressure consistently exceeds 140/90, you likely have hypertension, which can lead to serious health issues such as heart disease, stroke, and kidney disease. Now let's talk about the stages. If your blood pressure falls between 120 to 129/80 to 89, you have stage 1 hypertension, which is considered mild and can be managed with lifestyle changes like weight loss, regular exercise, and a healthy diet. If your blood pressure ranges from 130 to 139 and 80 to 89, you are in stage 2 hypertension, which is moderate and requires more careful attention to your lifestyle. Incorporate potassium and calcium-rich foods into your daily diet, as well as deep breathing and the previous mentioned steps. By adopting a healthy lifestyle, you can effectively manage your blood pressure and potentially avoid the need for medication, leading to a healthier, medication-free life.